Good afternoon, dear friends. This is Natalia on the Doctor Online channel. From the perspective of normal physiology, vomiting is a common reflex that occurs when there are various kinds of malfunctions in the functioning of our body. First of all, it appears during intoxications, food poisoning, and diseases of the gastrointestinal tract. It can also accompany a hypertensive crisis and severe pain of any localization. Today, I want to draw your attention to the problem of vomiting bile, which each of us has encountered at least once in our lives. Why is bile sometimes present in vomit? Let me start by saying that bile is a specific fluid produced in the liver, which enters the duodenum through the bile ducts. Moreover, it enters the gastrointestinal tract only during meals, and in between meals, it accumulates in the gallbladder. The appearance of bile in vomit signals disturbances in the functioning of the gastrointestinal tract, which may occur temporarily or persistently. And how can you determine the presence of bile in vomit? By its characteristic greenish-yellow color and bitter taste in the mouth. Normally, bile from the duodenum enters the small intestine along with food masses and does not flow back into the stomach. It can only be thrown back in the presence of certain gastrointestinal problems and most often with stomach and duodenal ulcers. In cases of liver pathology, particularly chronic hepatitis, including those of viral origin, in cases of pathology of the bile ducts, often after the removal of the gallbladder, vomiting bile is also characteristic in cases of pancreatic disorders, narrowing of the stomach's outlet. In other words, pyloric stenosis can also be accompanied by bile vomiting in the morning hours. Perhaps one of the most dangerous conditions accompanied by vomiting bile is the narrowing of the intestinal lumen up to its complete obstruction. In this case, uncontrollable vomiting can be one of the symptoms of an intestinal tumor. In this case, due to its obstruction, there is a backward flow of bile into the duodenum and then into the stomach. Among the range of serious oncological diseases, one of the manifestations of which is vomiting bile, we can highlight cancer of the pancreas, liver, bile ducts, and intestines. Intestinal obstruction can simply occur even with fecal impaction. This condition can have rather unpleasant consequences if you don't seek help in time. Namely, it can lead to necrosis of the surrounding tissues, followed by perforation of the intestinal wall and the subsequent development of peritonitis and sepsis. By the way, intestinal obstruction can be caused by a whole range of other factors. I mean adhesions that occur after surgery, volvulus, metabolic disorders, for example, decreased potassium in the blood, and infectious diseases of the gastrointestinal tract. For the sake of fairness, it should also be noted that vomiting bile is not always a sign of dangerous diseases. This symptom can also be observed in cases of alcohol poisoning and may indicate severe intoxication of the body. It can also occur during pregnancy as a manifestation of toxicosis. So, having figured out why vomiting bile occurs, the question arises, what should be done about it and what measures can be taken at home? The first thing you need to do is wash out the stomach. For this, a weak solution of baking soda will work, about half a teaspoon per glass of slightly warm water. To achieve the desired effect, you need to drink up to 8 glasses of the soda solution and then induce vomiting. Let me say right away, this method is only suitable if we are dealing with food poisoning or alcohol poisoning. In all other cases, it is necessary to find out the cause of vomiting bile. For this, you will need to have a biochemical blood test, examine the condition of the stomach and duodenal mucosa using the method of fibrogastroduodenoscopy, and also undergo an ultrasound examination of the abdominal organs. With uncontrollable vomiting, dehydration occurs, so it is important to drink as much fluid as possible. You can relieve your condition with the help of an herbal blend that includes green tea, rosehip, and mint. You should drink this decoction every hour in small sips, preferably on an empty stomach. In cases of repeated vomiting, a solution of rehydrin is also recommended to normalize the water electrolyte balance and prevent dehydration. Fatty, sweet, and flour-based dishes, as well as marinades and smoked foods, should be excluded from the diet. In addition, tomatoes, cherries, sweet cherries, cabbage, and oranges should also be avoided. The menu should consist of low-fat fermented dairy and vegetable dishes, preferably baked. A small amount of lean meat and low-fat fish can also be included. To remove toxins from the body in case of poisoning, Ataxil, Polysorb, and activated charcoal are recommended. To stop vomiting, Motilium and Sirucal are successfully used. I also recommend that you watch a video on how to treat dysbacteriosis without medication. Stay healthy, friends. See you next time.